So welcome back to the YouTube channel. This series of videos is providing 3-minute succinct summaries of potentially practice-changing randomized trials for general internists. This was a trial of IVIG and dermatomyositis. My name is Mike Freilich. I'm a clinician scientist. I look after patients when they're in hospital, and I also do research, among other things. The methods for this study, I like to break studies down into PICOT and then PHOBIA. Let's walk through that. So what was a population? Adults with active dermatomyositis. What was the intervention? IVIG. What was a comparator? Placebo. And what was the outcome? It was response measured by total improvement score. This total improvement score considers a patient's symptoms, lab values, as well as other aspects. Timeline, so it was 16 weeks of follow-up. And then understand the strengths and weaknesses of the study design. I created this mnemonic called PHOBIA. Was it placebo-controlled? Yes. How was it funded by industry? Was the outcome clinically relevant? Yes. Was it blinded? Yes, in this case, double-blinded. Was it intention to treat, which is usually the ideal approach? It was actually quite unclear. I'm not sure what they did. And were there a lot of centers? Was it a multi-center study? Yes. So what did the patients look like? They approached 126 patients, just under 100 were randomized. A loss to follow-up was rare, which is important. Average age was 52 years, 25% were men, nearly 90% were taking steroids, and the mean time since diagnosis was 2.5 years, and 14% had severe disease. So what did they find? What they found here is that patients who received IVIG had much higher rates of improvement of their symptoms, of lab values, compared to patients who got placebo. Some secondary outcomes. So the primary outcome was looking at minimal improvement, but they also observed moderate and at least major improvement for those who got IVIG. Some drawbacks. Side effects were much more common in the IVIG group, and venous thromboembolism or blood clots were one of those. Limitations of this study. It was relatively brief, so who knows how well these results would sort of hold up over longer durations of time, and a relatively small sample size. I think for me, it clearly showed that there was significantly higher improvement among adults who received IVIG. And as a practicing clinician looking after patients with dermatomyositis, these patients can be really sick. I need the help of my rheumatology colleagues, and it's great to know there's a treatment, a new treatment that can help them. Thank you to both Natasha and Harry for producing this video. Take care.